So when you're going to do your demonstration, you're going to make sure you knock on the door, or if the door is open on a patient room, you're going to make sure that you knock on the door and say who you are and announce yourself. So you're going to knock on the door, hello, say who you are, if you're a student nurse, if you're a real nurse, if you're the instructor, and you're going to wash your hands. Of course, I usually get way too much hand gel, and this time I didn't get enough. So you're going to wash your hands, you're going to introduce yourself. So can you tell me who you are today?
Wait, I thought you had to introduce yourself. No.
I explained that to everybody.
Okay, so then I say who I am.
Yes.
As the patient.
Yes, you're the patient.
My name is Liz.
Okay. What is your date of birth?
2/12/2000.
Okay, and I'm going to pretend she has an arm bracelet on and I'm looking at it. And I have verified with 2 things that it's correct. So she was confused if she was the patient or the person who had just identified themselves. If we were doing neurology, she'd be disoriented. Yes, that's correct. Okay. So, all right. So you would make sure you pull the privacy curtain or shut the door, and you're going to say to her, I'm going to examine your head and neck today. Is it okay that I do that today?
Yes.
Is it okay that I touch you?
Yes.
Okay. And we're going to pretend that she's not in a rolling chair in a lab room, and that she's in the bed, and the bed is in a safe position, it's locked if need be, or if she's sitting in the chair, it's not a rolling chair, and it's not going to move, and she's not going to fall out. And you're going to announce that the patient is safe, okay? And that you're safe, the client is safe. And it's okay that I touch you and examine you, correct?
Yes.
Oh, all right. Have we got all that? Any questions so far? Yeah?
What if they don't have, hear me out, I guess for it's Emily by the way, for this demonstration we could just pretend it's in a hospital setting, but what's acceptable if they don't have a hospital bracelet on?
You can just say that you've identified them with 2 identifiers and you're pretending.
Okay.
Yeah, you're just pretending.
Okay.
Okay? So you're going to look at her head and look to make sure it looks normal, okay? And she's a bad girl today. She did not wear her hair up.
It's been a really long day.
Okay, and you're going to look around her head, you're going to palpate it, you're going to see if you find a bug or anything like that, or parasites or lesions. Hopefully we didn't find anything like the lizard that was found next door. There was a little something crawling over there.
Someone's hair?
Oh,
Hold on. No. Absolutely not.
All right, so you're palpating all along the head. You're touching her all over, no, just on her head. Okay, her head is normocephalic, her hair is evenly distributed, there's no parasites, and there's no lesions noted. Okay? You did not see any masses, deformities, and she did not scream when I touched her head, so there's no tenderness to palpation. Okay? Okay?
Do we need to state all that when we do the exam?
Each one.
How do I know there's no bugs in her head? Am I looking at her head?
You have your little cheat sheet. We did not scream. Or, you know.
Oh, so we have to say
Or
that, like
run.
no bug seen,
Yes.
no this.
Right.
You're going to say head is normocephalic,
Oh, the hair.
hair is evenly distributed, there's no parasites or lesions noted. Okay, no masses, deformities, or tenderness.
What is that first thing you said?
Masses, deformities.
Normocephalic.
It's on the sheet.
No, it's not. This is my cheat sheet.
Oh, just kidding. Okay, it's not
Oh,
on your
so
sheet.
But it's on the PowerPoint.
It's all on the PowerPoint pretty much,
It's all in the recording.
and it's all being recorded, so you can watch as many times as you want. So you're going to look at the eyebrows, eyelashes. Do they look symmetric? Do you see any? Well, I don't know if she's got big ones on or not. I don't know.
I do.
Oh my gosh, they're pretty thick there.
But
Okay.
they're attached to my real eyelashes, so therefore I have.
We're learning a lot about Alexis today. Okay. Stop. We're just gonna say her eyebrows and eyelashes are evenly distributed. We didn't see any lesions, redness, or discharge noted there, okay? All right. Now, can you pull down your eyes? Now, if you can't see in there, just like that, or you don't have well enough light, you're gonna take out your pen light and you're gonna shine the light in now. What?
You didn't ask if you can assess her eyes. We're just
Oh.
nitpicking.
You're nitpicking at me?
We're getting all of our steps down.
Okay, all right.
Minus 20 points.
Off rip. Off rip.
There's no
Dang.
redness, discharge, or bar lines there.
She didn't have any sleep.
I already asked if I could touch it.
That's true, you did. And I had to touch myself.
And the second time I just looked at her and I said, can you pull down your
Yeah, you
eyelids?
I
Did I touch her eyelids?
No. No.
But you look good.
Ooh. Oh, boy.
We just
If you
that's
want
why.
to keep our papers,
People,
Awake and ready to go.
people are feisty today.
aren't they?
I don't know. I don't know if I should help them out anymore. Maybe they should guess. What do
Oh
you
no,
think?
I'm ready. Let's, we got it.
Okay. So now for the next three, which are critical, okay, critical. You're gonna look at the pupils like I went over during the PowerPoint slides and showed you. You're gonna look at her pupils. Now when people are dark skinned, okay, or they have real dark brown eyes, it's sometimes hard to see their pupils. So sometimes a bright light shining over makes it a little bit more difficult to see the pupils react. So sometimes you may have to cover their eyes a little bit, etc. in real life to do this. But sometimes if you're good and you've been doing it for 30 some years, you can probably see it. But you're gonna shine the light in and you're gonna watch both eyes constrict. Okay?
Are they constricting?
Yes, you're alive, my dear. Okay, so both pupils constrict. Okay, then you're gonna watch them dilate back, okay? So then you're gonna say, can you look at this? Okay, and then you're gonna follow that in and they should constrict and then they should dilate back out. Okay. Now, they are parallel. Pupils are equal, round, reactive to light and accommodation. Okay? Yes, I already said that during the slides, correct? Okay, now can you please follow my pen light? Okay? Now I go up and down because I'm neurology and there's other issues involved. Now what I see students do, and you don't have to follow my pen light, is go to your partner. So you may not want to do that to your partner. Okay? The 6 cardinal gazes are intact, or you can say extraocular movements are intact. I'm sorry I do not have a Snellen chart here, but we're gonna pretend. Can you cover your right eye, please, and read the lowest line over there?
A, B, C, D.
Okay, can you cover your left eye and read the lowest line over there?
A, B, C, D.
Okay, can you read now with both eyes uncovered?
A, B, C, D.
Great, thank you so much. The vision is 20/20 bilaterally. Remember, you are always comparing sides. Yes?
So for our demonstration, are we gonna be like using a small Snellen chart? Or
I'm going to try to hijack a Snellen chart.
and then for like a small Snellen chart, isn't it like 5 feet or I know it's a shorter distance.
You can practice saying 20/20 bilaterally.
Okay.
You can practice the normal. I'm not making you memorize abnormals, or if you find something abnormal, to memorize abnormal. Okay?
I was gonna say, he has glasses, I don't know.
And bifocals.
You can say with corrective lenses on. Okay?
I have a question.
Sure.
There's, Aurora and, consensual light reflex, and then the red light reflex, is that?
That's for your test. Okay? The pupils are equal round reactive to light and accommodation means that both pupils are responding at the same time to light. So when you shine the light in one eye, the other eye is consensually responding. That's the consensual response. The red bright light reflexes, when you take a picture of a camera and you ever see that red spot? Okay? Sometimes it's based on where the light responds and reacts back on the retina and stuff. But in some people, if it's not there, it can be an abnormality, especially in younger children. And remember, I'm not a pediatric expert, but they can have a tumor or some other abnormality back there. Okay? So that's why it's important to know that. But with these bright lights on ahead, above ahead, you're not going to see that red light reflex very well here. But that's mostly for pediatrics. Okay? All right. So you're going to look at the external ears. Can you uncover your ears, please? Oh my gosh, I think they're way too low set. No, they're fine. You can look. You can look at the outer canthus here and measure them. And I've already looked at them both bilaterally because when you're a nurse practitioner and you've worked as long as I've had, you have to assess things very quickly. So I already looked very quickly, and both her ears were at the same position above the outer canthus. So you can say normal alignment, proper alignment, whatever is easiest for you, okay? They're symmetric bilaterally, you're gonna look in there, okay? They're symmetric in size, shape, etc. You're gonna look in there, you're gonna look in there for any excess cerumen, discharge, redness, lesions, and then you're gonna say there's no excess cerumen, discharge, redness, lesions noted. Okay? Then, can you tell me where I'm rubbing my fingers together?
Yeah, right here.
Okay.
And left.
Both. I tricked you the first time. Huh?
Yeah, I didn't hear anything. I got nervous.
Alright, so you're gonna pull up on both the pinea and then push on the tragus. Sorry, I forgot to ask, was it okay that I touch you right now? Oh my God. You already asked in the beginning, so really, as long as you're asking in the beginning, you should be really be fine. You can also just tell the person if at any time you're uncomfortable, please stop me, and that should be fine. Or if you're uncomfortable with the examination, please stop me, and that should be acceptable. All right. Since we're having whatever going on. Okay. All right. So you pushed on that. So there's no tenderness to palpation on the pinea or tragus bilaterally. Okay. You've done the whisper test. Hearing was intact bilaterally to finger rub actually, or the whisper test, whichever one you're going to do. Okay. So the nose. So you look at the nose. It's midline. Outwardly, you don't see any significant deviation, you don't see any lesions or other abnormalities or discharge notice. You don't see something running down her nose. And she's very bad again. There's something on her nose that shouldn't be there. Okay. All right, we're gonna look up her nose. Okay. All right. Alright, so you're going to say nasal mucosa is pink, no edema, swelling, however you want to word it, no nasal discharge, no lesions. Okay? Did I miss something? Or you can say it's consistent with ethnicity. If the skin, the color in there is a little different. Then you're gonna say to her, and the septum is midline. I forgot that one. I get a little sleepy after lunch too, that's why I have my cheat sheet. All right, cover one there, please. Can you cover one side of your nose, please, and breathe in? And the other side, please. And she is a little congested, which I did note when I looked up there, but I wasn't gonna share that. So, the ears are patent bilaterally is the proper terminology. Okay? All right. So we're gonna push on our frontal sinuses, right above your eyebrows here. And maxillary sinuses are right below the eyes, above there. And you push down, and usually if somebody has significant pain, they would tell you. So there's no tenderness to palpation bilaterally, the frontal or maxillary sinuses. Okay? So you can look at her lips. They do look a little dry. Yes, I agree. So, but for normal sake, they would be moist, pink, without lesions, okay, or no lesions noted, whatever you prefer, or you can write consistent with ethnicity, okay? Then you're gonna look at the gums and the teeth. So can you open your mouth for me, please? All right,
Sweet onions.
I don't think so. Can you pull down your gums?
Do I have any what?
I said sweet onions.
Oh, no.
Alright, I can pull up the top gum for me. Alright, can you let me see inside your cheeks? Say ah. Alright. Oh, ah. Alright, she's saying ah too. She's going way hot. Say ah. Ah. You do have your tonsils, don't you?
Mm-hmm.
Alright. Sadly, she has her tonsils, she says. Alright, so we'll go down. Teeth are intact. I didn't see any new caries noted, no missing teeth noted, no teeth needing repair. Okay, the gums were without erythema or inflammation. If you prefer that, I didn't see any bleeding or discoloration. Okay, so the mucous membranes were moist, pink, and no lesions were noted. Okay, so the uvula did rise with phonation. And the tonsils, and it was midline, okay, bell-shaped, and the tonsils were roughly, about 1 to 2 plus. Plus you use a tongue blade, it's sometimes hard to see, and it was pink without any exudate. But we don't want to stick a tongue blade back there and make anybody gag. Is that going to be one of your questions?
No, should we be checking sublingual too? Like underneath the tongue?
We didn't get to the tongue movement yet.
Oh, okay. Well, I just figured since you were like in the mouth, it was all
in
involved.
there.
Yeah, we didn't get to the tongue movement yet.
All the
Okay.
way there.
Can you stick out your tongue and, all right, can you move it up? And that's when you can look under the tongue. Can you move it
Don't
side?
some people have that missing? You know what I mean? The little thing that
The
is.
fornica or whatever, the
Frenulum.
frenulum, whatever,
Yeah.
yeah. I think there's a bunch of deviations, a bunch of places. Can you move it side to side, touch your cheeks, and touch the roof of your mouth? Okay, all right, and you stuck it out. And the tongue was midline, yep.
So with cranial nerves, that would be without like moving the tongue side to side.
Mhm, yeah,
Is
and
that
you're
gonna be
supposed
okay
to-
with this?
You're supposed to check range of motion, movement, so it's supposed to be midline with full range of motion, pink boots, no lesions, no rough appearance noted.
Okay.
You know, sometimes you have those little rugae on the back. And that will be the hypoglossal nerve. So on some of the slides, you saw that I put some of the cranial nerves on it for H, E, and T. That's why. Yeah. But, there you go.
Do we need to state the cranial nerves when we do?
Not for this one.
Okay.
But your next one. That's why I kind of put them on the slides with the. All right, so her neck is midline. We're on to the neck. So you don't see her bobbing her head around. Some older people will do that. So you're just looking at the neck, it's midline. And I don't see any masses just looking at it. And I don't see any involuntary movement. So it's midline, no masses noted. You know, you can say upon inspection if you want, because in case you palpate some later, or involuntary movements. Okay, so then you're gonna ask them, their active range of motion, can you turn your head side to side? Okay, forward, backward, and around in a circle. Okay, all right. And then you're gonna check the motor strength of the neck muscles. I don't think I need that again. Shrug your shoulders up. Okay, and then turn your head against my hand and against my hand. And head, neck, and shoulder movements are bilaterally symmetric at 5 out of 5. Okay, and then you're gonna look for her trachea. Remember, you're going down to where your clavicles end, and you're just gonna look in the midline and you don't wanna push too much, especially after somebody ate, okay? And her trachea is right there in her midline, okay? All right, you can add without deviation or shift if you desire, okay? All right, so I always get behind people. There's a technique for anterior as well. It's on the videos. You just kind of run down. You feel the cartilage in the cricoid area, and then kind of go down there. And if you're real good, you can sometimes feel it without asking them to swallow, but you're supposed to ask them to swallow. So can you swallow for me? Can you swallow? And her right side might be a teeny bit larger than the left, but I don't feel any significant nodules or anything like that. She's got a little bit bigger neck muscles. Not side, but that is sometimes with some people. Some people do. Some people do.
No, it's the look on her face when you said it.
And she's being recorded too, Mark.
Is it cause like, I don't know, do I like work, I don't know, do I work out this side more than the other?
People are just different.
Alright.
Okay.
It's normal.
So you can say the thyroid was palpable without any nodules, masses. It was non-tender. Okay. So you can say it was symmetric bilaterally without any abnormal enlargement, masses, nodules. You can say you can feel the thyroid was not palpable, no tenderness or palpitation to the area. Got that part? Everybody's ready to do it today, right?
No.
Alright.
That's a good step.
Alright, so I'm going to show you from this way so you can see. This is how I normally wouldn't do it this way. I'd be in front of the patient, but this is pre-auricle, before the ears. I'm making sure I'm before her ears. I can't see her. Post-auricle is right behind the ears. Then occipital is back here on the back of the occipital bone. And then you got, let me see, make sure I got your chin. And then you got submental, submandibular, tonsillar. And then you got right where that sternomastoid muscle is. You got the anterior cervical chain, the posterior cervical chain, and then right on top of her clavicle, right above there is the supraclavicular. Okay, then you're all done, and you say to the patient, I'm all done. You can review your findings. I didn't find anything abnormal. Thank you so much for your time. Do you need anything? You can give them a call right back. If you raise their head of the bed, you make sure you put it down because nurses do not want to hurt their back. You open the privacy curtain, open the door. You make sure you were nice to them the whole time. If you were mean, then that's it. And then after you're all done, you make sure they have everything. Do you need anything else? Thank you for being so cooperative and let us videotape you today. But we did have to have some humor during it. Sorry about the ear chat.